as mentioned, I'm a producer with CNN based in the Hong Kong production hub. Mainly doing features. A lot of times those features end up on CNN International. Before that, I was a bureau producer based in Johannesburg, South Africa. And it's really no surprise to me that I ended up in South Africa because I studied abroad in South Africa. I was part of the initial group that went to Stellenbosch as part of the Global Health Program. So I don't want to say I've been milking global health throughout my entire 5 years at CNN, but it certainly helped me. When I first started with CNN, I was a lowly kind of PA, AP, and they were launching this new concept with Dr. Sanjay Gupta. And they wanted to have an international, kind of take his domestic show, but broaden it out and to have it air on CNNI. And I was sitting in the meeting, and I was listening to this happen, and I kind of just mentioned, I'm like, well, I was actually a global health minor at Northwestern. And no one in that entire room kind of knew what exactly that meant, but it sounded really good. And so they immediately, you're on that project, that's you. And so from there, I kind of just took it and ran with it, and I actually went to Brazil and to do a story on HIV/AIDS treatment and prevention, the success story in Brazil. And for them, again, it was a chance to kind of tell the story in a way that maybe we weren't doing in the past. Take a look at the positive, take a look at generic drugs and the impact that that has had. Because a lot of these stories, a lot of these health stories, there's a lot of viewer fatigue. And kind of through global health coursework, I learned kind of unique ways of telling it, or the impacts that that these health issues have on not just politics but public opinion, and to kind of have that context. So then after that, I put my hand up for the Johannesburg Bureau, and it was the same thing. It was like, why do you want to go to Johannesburg? Well, actually, I studied abroad for the global health thing again in South Africa, and they said, it's a good fit. And I would say there's not a week that goes by where I don't have to. Not necessarily, I don't remember everything I learned in my coursework. I'll be honest with you. We're kind of surface level as journalists, but at least kind of the critical thinking and at least some of the issues. And I'm just surprised that some of the things that I've taken for granted as a global health major, some of these themes and especially in health, that it surprises the average viewer, and it surprises the producers I work with when I get script approval. They're stunned. They can't believe that some of these things in South Africa about corrective rape and just how prevalent rape is in South Africa. They're blown away by it. And for me, I was learning about this 5 years ago at Northwestern, and there's so much academic papers. There's so much research for this, but I've got I think I've got the really kind of, I'd say it's a joy to be able to take that, translate it, and give it to a wider audience.